the efficacy of both these vaccines by taking blood from the vaccinated individuals and seeing how effective that is in the laboratory.
Let me bring in our guest joining us on the broadcast, Dr. Sameer Gupta from the Metro Group of Hospitals, now joining us on the broadcast. Dr. Gupta, good to have you on the broadcast with us. Now, we've seen the cases over the last at least 2 to 3 weeks. A lot more clarity has come forward as well. How much do we now know as far as how dangerous or how virulent this new strain is?
So one thing I always talk about COVID is that we know a lot about COVID, but there's a lot more we don't know. Every day we are learning something new about COVID. And now, as far as this Omicron is concerned, if you look at data from across the world, whether it's South Africa or it's Europe, the surge is happening over there at a pretty dramatic speed. Omicron has now become the dominant virus, the dominant COVID virus, replacing Delta in South Africa and also in Scotland and many parts of Europe. There's also data coming out that the 2 doses of are not as effective as possibly a booster dose. Now, the question is, how much do you have to wait for the booster dose? Is it because of reduction in immunity or your antibody titer going down over a period of time, which leads to an increased chance of getting infection, versus this is just an immune evasive mechanism that the virus has? So there are many questions which remain unanswered. Now, I know a lot of us we've heard a lot that the virus is possibly mild and just going to be like the common flu. But in a population, when there's a virus which can spread fast, even though it is mild for majority, the number of people who will net get affected is going to be much higher, right? So if you have a mild virus, which is spreading rapidly, mild for most, then a lot more people can get affected. Now, we have data coming out of South Africa that this time the Omicron virus is affecting children a lot more.
Correct.
When you compare, there was a recent webinar in which they were talking about it. That,
even in India, one of the cases that is coming from Bombay, coming from Mumbai, that's of a 3-year-old child as well.
Exactly. So a lot of hospitalizations coming out of Schwan in South Africa are of kids between 0 to 5 years of age, and they are the unvaccinated people,
Dr. Gupta, that's exactly the question that I was getting to. That's why it's raising 2 concerns. One is on a booster shot. Across the globe, we're already seeing countries advocating booster shots. In India, you've got the ICMR director saying that from the time you took your second jab, 9 months after that, you don't need a booster shot. The other concern, as you rightly pointed out, are children who are now experts saying the most vulnerable are still unvaccinated. Where do you, stand on booster shots first?
So I think, in a population like India, it's kind of the volume is so big that vaccinating everyone becomes a challenge. In a phased manner, booster shots may be the way to go. Now, somebody like me who's a healthcare worker, I was in February, right? So I had not gotten any vaccine after that. Now, there were many people who took the second shot maybe in August or September or October. So their antibody titers and their immunity may be a little bit higher. So maybe restarting the booster shots in a phased manner may be something which we have to consider. And also the vaccine makers have to go back to the drawing board and try and tweak the vaccine a little bit to cover Omicron also.
Dr. Gupta, the concern is, before I let you go, that, from the time you've taken your second vaccine shot, how long does immunity last?
So, this is data which is coming out that slowly and steadily, like the ICMR is saying, that so now there are 2 types of immunity, right? One is the antibody immunity, which is your soldier cells, and the other is the T-cell immunity. The T-cell immunity basically means that your body can recognize the virus, and when you are going to get infected, the body will start making antibodies against that virus because it has the recognition ability. What we don't know is can Omicron fool the body and evade the T-cell immunity. That is information we don't have. To give you an example, if you've got a measles vaccine as a child or even as an adult, The next time you're going to be exposed to measles, maybe 10 years later, 20 years later, your body will recognize the measles virus and produce antibodies towards it. So we do not have enough information about the T cell immunity.
Sure.
The B cell immunity, or the actual antibodies which everybody goes and measures in the lab nowadays. That slowly wanes off over a period of time. Maybe 9 months is what the data we have, because the vaccines are only a year old.
Okay. Dr. Gupta, we'll leave the conversation there. Still a lot more that we need to know about this new variant. Now, as part of our series is India Omicron Ready, today we take a look at how Delhi is gearing up to contain the spread of this new variant. Nikhil Lakhwani with this ground report from the LNJP hospital, where the sole Omicron case, now we've got another confirmed case in the city as well, that has been reported so far.
We all remember how the last COVID wave brought the national capital on its knees. People were running from pillar to post in search of oxygen and the available beds. But this time, when the another wave is likely to hit the country hard, how prepared the city and its hospitals are, we bring you this report.
At the height of the second wave, Delhi's healthcare system was woefully lacking. Whether it was oxygen cylinders, hospital beds or even medicines, people struggled to get their hands on them to save their loved ones. Now a new variant poses new challenges, but the Delhi government says it's prepared to tackle Omicron.
इस वक्त हम लोगों ने 30,000 ऑक्सीजन बेड्स तैयार कर लिए हैं। 32 किस्म की मेडिसिन्स हैं जिसको अलग-अलग तरीके से कोरोना के दौरान इस्तेमाल किया जाता है। उन सारी मेडिसिन्स का 2 महीने का बफर स्टॉक ऑर्डर किया जा रहा है।
Delhi's LNJP hospital, which was declared a dedicated COVID hospital last year, is gearing up. All beds have oxygen and medicines have been stocked for the next 3 months. This 500-bed COVID ICU facility in LNJP hospital was built during the second wave. It's equipped with ventilators and a central oxygen line.
थर्ड वेव को लेकर हमारा युद्ध स्तर पर तैयारी है और हमने सारा जो इंफ्रास्ट्रक्चर है उसमें सारे ऑक्सीजन बेड्स हैं, सेंट्रल पाइपलाइन है और आईसीयू बेड्स हैं, मॉनिटरिंग सिस्टम है। पहले हमारा जो कैपेसिटी था पर डे 5 टन था, अभी हमारा जो पर डे कैपेसिटी है 55 टन पर डे का है। तो अभी इस बार हम फुल्ली प्रिपेयर्ड हैं।
While hospitals appear to be prepared, citizens are being far from vigilant. Mask and social distancing norms have gone for a toss in most places, and these violations are going unchecked.
The Delhi government says that they are well prepared than ever before, and if need be, they can accommodate as many as 63,000 beds for the COVID patients by the end of the month of February. During the last wave, people were feeling crippled in search of not only for the medicines, but also for the essentials. Now the government says that they have adequate stocks of the same. But how prepared the Delhi government was ahead of the next wave will better be known when the cases starts to rise and the country gets hit by another COVID wave. With camera person Rajesh Bharadwaj, Nikhil Lakhwani for CNN News 18.